Hey, this is David Miller with the Miller Group of Keller Williams Realty. And once again, I have one of our preferred vendors on the line here. And he's going to be talking about how his company, Right at Home, really provides home services to the senior community. I'd like to introduce Rob Hoffman. And Rob, you are the manager of Right at Home here in Central Florida. Is that correct?
Manager and the owner also.
And the owner also. Okay, okay, great, great, great. So let's jump right into this here. Obviously, the forefront of everybody's mind is the virus and how that's affecting everybody. It's affecting everybody in different ways. So how is this affecting your side of the business?
Well, it's making us feel very much more careful than we were in the past on how we deal with everything. We're doing a lot of training of our caregivers to make them aware of what they can do to stay safe and to stay healthy. We're going over the techniques that are being preached by the CDC and the World Health Organization, the hand washing, social distancing. We're encouraging our caregivers to wear a mask when they're out in public and mandating that they wear a mask when they are with clients. Another big part of it is we're also training our caregivers on what to look for in their clients, themselves, and their families as far as symptoms of the disease. So it could be detected if anyone came across it. Tiredness, shortness of breath, coughing from the chest, all the different symptoms. Fortunately, as of today, we have had no clients and no caregivers that have tested positive for the disease. So we're very thankful of that.
Absolutely. That is great news. So, and I should have started off with this, Rob, I apologize. So what exactly does your company do? I mean, how do you help the senior community and the services you provide? What does that help them do?
Well, the big thing I think that we do for seniors and for adults with disabilities, we don't work strictly with seniors. We also work with 30-year-olds with a disability. We've had clients as young as 28 years old. But we help them stay independent. We help them live where they want to live, whether that's in their home, their apartment, whether it is in a independent living community. But we want to help our clients to maintain their independence, and we do that by doing the little things for them that they find difficult to do anymore. That could be anything from changing bed linens, which gets a little difficult for people as they get older. Assisting with laundry, ironing. It can go as far as bathing or helping change undergarments for the folks who need that service. And we'll also run errands for our clients and help them with pick up things from the pharmacies and anything that they find difficult to do that'll help them keep their independence. We're there to help them with.
Okay. And it sounds like you said that you can do it if they're at their house. It sounds like you can also do it if they're already at an assisted living community or maybe an independent living community. So it doesn't matter where they're located. You can provide that service anywhere.
Correct. Yes, we work in people's homes. We help out folks who live in nursing homes, assisted living, memory care, or independent living. We can go in all those facilities. And right now, with the pandemic going on, our staff is allowed to go into facilities where family members are not. So in many cases, we're the eyes and ears for family members right now within a facility, so they can get information on mom or dad. We've even done FaceTime calls with family members so they can talk to their parents because they're not allowed to go in the facilities right now.
You know, that's a great point, Rob, because you watch on the news and that's the biggest complaint is that the family members can't see them. And obviously we know why, but to have somebody come in and maybe do a FaceTime call, that's probably a little bit better than just trying to talk to them through the windows, right?
Yes, very true. And unfortunately, there are some folks within facilities who can no longer use a phone, can't dial their family members. So we're dialing phones for them to help them out so they can still communicate with the sons and daughters out there.
Gotcha, gotcha. Now, what services do you not provide?
We are considered non-medical.
Okay.
And in some verbiage out there, people will call us unskilled, but we don't like to refer to our caregivers as unskilled because they're very good at what they do.
Yep.
So there are things we can't do. We can't change a catheter bag. We can empty a catheter bag, but we can't change it. We can't do wound care. We can clean around the wound, but we can't do wound care. We can't administer medications, but we can remind people it's time to take medications. So we bump right up against medical services, but we have to be careful because we are non-medical.
Okay. And I think you said earlier you do provide different levels of service that you can provide for the person you're providing the service for. Then is that correct?
Correct. Yes. Yeah. I mean, some of our clients don't need anything from a personal standpoint. They're very capable of using the bathroom themselves, of getting a shower and cleaning themselves. But they want somebody to come by to talk to do a puzzle with, to watch TV, to go for a walk with. So we'll provide companion care where we just kind of hang out with somebody and are a friend. I met with a woman today who, in our conversation after determining some of the things we were going to do for her, she mentioned that her husband passed away 12 years ago and a lot of her friends have passed away, so she gets lonely sometime. And I said, well, we're going to send somebody over. You guys can just sit and talk. And she just lit up because now she was going to have a friend, someone just to hang out with. So in addition to changing her bed linens and helping prepare meals and making sure she's taking her medication, have somebody to chat with a little bit.
So some of the questions I get is that the people that provide these services for you, are they employees of yours or are they like contracted labor?
There's two business models who do this type of work. There's agencies, which we are, and there's registries. Agencies, the caregivers are employees of the registries. So as employees of our company, they're covered under our workers' compensation insurance, and we have other forms of liability insurance, an umbrella policy over their car, and other types of insurance in case there's any problems. If they get hurt in your home, we have workers' comp. Doesn't go against your homeowner's policy. So our caregivers are employees of ours. Because they're employees, we also pay them to come in and do training. You know, we assign different training for them and we pay them to come in and do that. So yeah, we use the employee business model.
Okay. Okay. So the big question probably is, hey, this sounds great. You can do all these services to allow me to, companionship or, do errands and all these other things you mentioned. Obviously, there's a cost associated with that. Do you happen to have any numbers you could share on what people are typically looking for? I know it depends on the level of care, but just some generalities.
It does. It depends a lot on the individual's needs and on their budget. And that's kind of the nice thing about home care is you can tie the two together, the needs with the budget. If a person can remain independent by spending $200 a week, they can probably get 10 hours of help in their home for that $200. And that's still a lot less than moving into a care facility. And they can keep their independence, they can stay in their home, all the things that go along with that. So it can run into a lot of money if you need 24/7 care within your home. And that's a decision people will have to make, when that time comes. But the nice part about home care is you can budget it. You can play it into your needs versus what your budget calls for.
Yeah. And I think to your point, you can sort of ease into it. You don't have to like jump right into it and say, I need all this service, because there's different levels of care. And as we get older, we start needing some services, and then we get older and things happen. We need more services. So rather than having to jump right into going somewhere full time, you could sort of use what you need. And then as things change, then you can sort of change with it then.
Absolutely. We actually had a client that we started working with the first month we were open back in 2015 when we opened our doors. And we were visiting and staying with this woman 2 times a week for 3 hours each time. About 2.5 years later, we were with her 24 hours a day. So it just gradually increased as her need increased. and we increased the staffing. But the amazing part was the caregiver who started with them back in 2015 was still there helping out as one of the caregivers in the 24/7 care. So we were able to keep the staff kind of the same as this woman's needs increased.
I bet you she really appreciated that then, didn't she?
Yeah, that's one of our goals. We really try to keep a caregiver successful and the client likes them and the caregiver's happy. We really try to keep the team together. It makes a big difference, makes it easier for everybody.
Absolutely. So Rob, why don't you share with them your contact information so they can reach out to you if anybody's watching this here that has a need for your services. And I'll make sure I'll put it down on the bottom as well so everybody can give you a call if they need your services.
Yeah, you can call us at our office phone number is 321-295-7849. And certainly visit us on our website at www.cflhomecare.com. And we're available 24/7.
Perfect, perfect. Well, this interview proves that I don't discriminate against who I bring on to talk to, because the services you provide keep people in the house. And of course, I help people downsize when they need to do that. So, I understand most people want to stay in their house as long as they possibly can. And your services allow them to do that. But of course, there always comes a time when it's time to downsize and go into a different place that's a better fit for you. And when that happens, give us a call. My information's below as well, and we'll be glad to help you guys out. So Rob, I really appreciate your time, and thanks for sharing some information with us here. And thank you for serving the senior community and the people that need your help the most.
Thank you very much. Appreciate it, David.
Absolutely. Have a good day.
You too.